Good morning, good morning, good morning once again, everyone. I hope all of you are in the best of your health. So, today's topic is the pain points in dentistry. For the in conversant with this webinar topic, a few of you joined much late in group number 4. We did an exercise from 17 July to 24 July in all the groups, where I asked the dentist colleagues to post their pain points in dentistry. They were given a freedom to post it anonymously also in my personal window, which I shared with them. All the cross pollination efforts were done. And of course, we came up with many results which were shocking, which were saddening, which were not fathomable as well sometimes. But yes, this is life. We have to understand. And I promised all of you that I'll be coming up with the solutions which I will be giving. I had already planned up these webinars, can say on 12th of August. So let's begin the conversation today. And before I begin the conversation, I would like all of you to understand that no profession is bereft from pain points. Every profession has pain points in dentistry. Ultimately, we all want to earn money. And yes, many a times in a zeal to do that, we fail. And we understand or we realize that maybe my luck is bad. मेरा luck खराब चल रहा है, मेरा तो भगवान मेरे साथ नहीं है, and all those things. But in actuality, as you will see today, there are so many things which are in our control, but we are not using it. So as usual, all my presentations always begin with the Lord Almighty has given me much more than what I deserve. So it is in my late dad's memory, who, if he would have been there with us, we would have been celebrating his 79th birthday today. Of course, lost him a little more than 3 years back. And in his memory, we do 2 days of education, the mini days of education. The first on 30th June on his death anniversary, and the second on mini education day 2 on the 12th of August. So thank you, Dad. Miss you always. Your blessings is always empowering me. So this is my brief CV. You all are aware by now. Let's move straight to the topic of today: pain points in dentistry. We will be discussing this topic in 2 parts, 2 1-hour sessions, 1 hour 10-minute max. So I'll try to wind up by 8:15, 8:20. So we all need to understand that every profession will have its pain points. No pain, discomforting, distressing, intense, horrible, unimaginable, and all those. The intensity may be from 0 to 10. Very rarely you will find people with 0. At least one would be there. Maybe they don't feel it. Maybe they don't realize. Maybe they try to look at the brighter side. But inevitably, everyone has pain points. It is nothing new for any profession. So if I go by the definition, it is just a specific problem which the owner or the customer of the business is experiencing. So you can say, simply speaking, in layman language, pain points are just the problems. But what we encountered in our data that was collected over a period of 1 week was way more than problems. So you can think of pain points, but I have tried to categorize all of them in broader categories. Of course, I have given them 7 categories. There is no hard and fast that this is the only list, but there can be many more points as well. But I've tried to club all of them under these 7 points: the financial pain points, the productivity pain points, the process pain points, the support pain points, the ethical pain points, the not in our hand pain points, and miscellaneous pain points, of course, the salaried parts, mostly belonging to the salaried, and a few miscellaneous as well. So the boundaries can be here and there. You might feel ये process में क्यों है, ये productivity में होना चाहिए, या ये process में क्यों है, ये financial में होना चाहिए. Forget that. I've tried to incorporate as per my acumen. I also might have done a few mistakes. Please pardon me for that. But this is the broader category, and each category has more than 15 to 20 subheads. And I'll be discussing each and every topic, and we are in no rush to complete. I have given you the time 60 to 70 minutes of presentation. And whenever the time is there, we'll try to wind it up and continue the same from there at 2 p.m. sharp. Similarly, without any introduction and all that. On no audio. Is anybody else facing this problem? If anybody is facing it, please write LC or no audio, or LC means loud and clear in the chat box. If you can see me and hear me clearly, please type LC in the chat box. Dr. Raghurandan, please check the same at your end. Please log off and log in again. So as I was saying, I'll finish this at 8:10 or so. And after that, I'll take up the queries from the points discussed. I've tried to include all the points under all the subheads under these 7 points. So I'll try to explain them. Funnily enough, as I was segregating all of them, trust me, most of these pain points already exist in the form of my YouTube videos as solutions for you. The only thing, if you have cared to open the YouTube video channel or the YouTube channel for this, I would say 99% of these are covered in the YouTube channel itself. Anyways, let's move on to the first financial pain point, known as the financial pain point. Let's all segregate them and make them into, you can say, pairs or categories. So the subheads under the financial, the number 1 point. I'll keep on discussing whatever it is one by one, each heading, each point. Wherever you feel any problem is there or any clarity is not there, please keep on writing the questions. Do not, or maybe you can type in the chat box, but do not, you can say, of course, I have unmuted all of you. You can't unmute yourself. So keep on writing it, ask me at the end. I don't want the flow to be broken. So this is the reason I'm telling. Thank you. So pricing and charging. This is one big umbrella, you can say, which can have endless discussion. I can go on this topic for the whole day for 8 to 10 hours. I have that long presentation with you. But yes, pricing and charging is the criteria. The most of the times the problems are the neighboring dentist is charging less, the patients don't agree to the pricing, and blah, blah. So the comparison of charges. If we talk about the comparison of charges, we need to understand why is the patient making that segregation. Have we made ourselves prone to that? See, there is a very simple formula in management which is used. E plus R is equal to O. Event plus response is equal to outcome. When any event happens, we have a response to that. And our response sometimes decides the outcome. If the patient blames us, you are in such a small setup. What makes you different that you are charging so heavily? We need to introspect. What is our differentiation? If we are 10 or one of the 10 or 12 in our area, what is our differentiating pain point? What separates us from the audience in our area or the patients or the colleagues in our area? So the comparison will always be there, but then it all stems from the fact that none of us wants to lose a patient. Whosoever walks through the door, these are a few common mistakes that we do. Number 1, everyone walking through your door is your patient. It's not. An ideal conversion ratio is 7.2. Means 100 walking in through your door, 72 get converted. You are doing very good. It is the ideal ratio. Of course, you may be doing 80, 85, 90. I don't deny that. But then there are colleagues who might be having 30, 35, 40 also. 50, 55 is the average maybe. 60 is the average. But an ideal ratio is 72. So number 1, not everyone walking through your door is your patient. Number 2, just try to listen to this chain very, very carefully. If you have less number of walk-ins, you will try to hold to whatever is walking through your door. भगवान के नाम पे जो आ रहा है वो ले लेंगे आप. Word of mouth is luck by chance. And then people will do what? They'll say, okay, I will do marketing. I will do advertising. SMM is the in thing or in vogue thing. SMM means the social media marketing. So I'll do the social media marketing. So one of you had written, I burned 60,000 in Google Ads. Okay. Ask yourself first, if you come across any ad to spend money or invest money, will you directly do that, or will you seek validation, or will you seek confirmation? Point number one in this, nobody is going to buy from you the first time they come across you. So what does it leave us with? I'm not saying paid marketing is not to be done. Settle up a base first. Word of mouth, chhod do. That is dependent entirely upon your good work, good internal marketing, good relationship with the patient, good feedback acquiring. Sometimes feedback works as a double-edged sword. पेशेंट को पता होता है कि मैंने अच्छा मेरा काम ठीक हुआ है, but unless or until you tell that patient to put in a feedback in words or audio or video or whatever mode the patient is comfortable with, the patient also doesn't get a confirmation to his mind that yes, my work was good. He does that, you place that testimonial or feedback on your landing page or on your website. That makes it a validating point. You have no website, no testimonials, no feedback, you are directly going into advertisement. Who will buy from you first time? No one. No one. So you need to understand, you need to be visible first. So what is the first step? You need to be visible, and for that you have to try the non-paid ways first, which is also known as organic marketing. Organic marketing includes, number one, presence or visibility on all the digital channels. There is no better time in the world than today to be yourself present, to keep yourself online. Presence online, I mean. If we are talking about your clinic, I am talking about that only. So try to understand, if you are not present online, you are not visible to the audience. There are so many options with everyone. People have so many things available. They will have so many options to choose from. We all know that. Number two, the networking with your local area people. Read in bracket shopkeepers. That is the cheapest and of course the non-paid or the organic way. So it spreads your word of mouth physically. The second way, where you are present online, on YouTube, on LinkedIn, on Facebook, maybe with a clinic page, all these will increase your digital presence. These are your digital footprints. So once you have all these, and along with that, your website, there are n number of options available for websites. Buy a domain, little bit of training, get it on Wix, get it on Doric, get it on so many options, which are free websites. Even Doric gives you a SEO option as well. Wix came with an option of .io options, but Doric gives you your domain name option. Of course, they may redirect it to that page, but you can do the SEO. Later on, maybe you can set up your own paid or dynamic website, or if not a static one, a dynamic one. So these things can be done later on. So once you have your digital online presence, you put up your testimonials, you put up your feedback, you put up your blogs, you create information and education awareness, you are present online with a validation. किसी ने आपके बारे में अच्छा लिखा है, somebody has written good about you in the way of feedback, and you are spreading awareness, and Google spreads it by the way of clicks and hits. Always have a text-rich site which provides knowledge, but again, effort करना पड़ेगा. Just burning your money in ads or putting your pamphlets or putting your boards, all these are passe now. Start with organic stuff, local networking and digital presence, and of course with a lot of effort to take feedback from your patients and putting it up online, so that when you place your ads, paid ads I mean, then somebody has a validation proof to check it out. अच्छा, इसके वेबसाइट पे ये फीडबैक दिया हुआ है, so many patients are good, so that means he is a trusted source. This is the way things work. Now coming back to this point which I am saying, when you have no dearth of leads or walk-in patients, that is where you will lose the fear of losing the patient. You will lose the fear of losing the patient. बस ट्रेन एक जाएगी दूसरी आएगी. I've omitted the third word. एक जाएगी दूसरी आएगी, एक जाएगा दूसरा आएगा, like that. So understand this first. Because we have less walk-ins, we want to hold to everything that we have. I do paid workshops. I do organic marketing only. I don't do any say paid marketing because of the amount of work that I can handle. Now, do you think if I am having 25 to 30 for my workshop, all 30 inquired? Sometimes there are more than 90 inquiries. All of them I put up in the temporary group. Out of that, some mature, some don't mature, but I don't follow up that, or I don't push that, because my life is not running because of these workshops. My workshops are just funding my future education. That's it. My house still runs from my 8 to 9 hours of practice. So that is the reason I don't push my workshops, and I do once in 6 months. Just to give an analogy, I'm side by side building up communities, because this is my way of giving back to the society. So once you have lot of leads flowing in, lot of walk-ins flowing in, courtesy your efforts, you will not have the pain here on the left side of your body in the chest, that I lost one patient, my patient did not convert. So you will lose that fear. And once you lose that fear, you will have ample work. But to reach that stage, you have to do some effort initially. And once you have a lot of patients walking in, courtesy lots of leads being generated because of your efforts, there will be less comparison of charges, there will be less bargain. Because जहां पे डॉक्टर फ्री होता है ना, वहां पे ज्यादा ये चीज पुश होती है, बिकॉज अंदर से डॉक्टर को भी फियर होता है, 4 दिन से वेले बैठे थे यार, ये आया, ये भी ना चला जाए कहीं. That is the mindset. If you don't have more walk-ins, you will have this fear throughout your life as long as you practice. Things have changed, my friend. My dear friend, things have changed. We are not living in the 90s or 2000 or even 2010s. We're living in the 2020s. So adapt and change accordingly. Icing on the cake was at the start of 2020, the COVID. Maybe the world would have been still struggling between online and offline. Today, online is the mode to learn primarily. Today, online is the thing to do it. But what I've told you in the past 5 to 7 minutes is a process. If somebody claims get a 6-figure income in 2 months, 3 months, 6 months, I'm sorry, he's lying. I'm sorry, he's lying. You need to keep patience, and you need to invest in the process to get earning out of it. So bargaining of charges, comparison between our clinic prices, timing. Since last few months, footfall is very low. It is difficult, means that bills remain same, income is reduced. Why have we not raised the charges? Only fear. Whatever we have, we will lose that also. Mindset. The mindset shift needs to happen. We don't want to make an effort and only curse and crib. मेरी किस्मत फूटी हुई है, भगवान को मेरे पे तरस नहीं आता, मैं अपनी क्लास का सबसे इंटेलिजेंट बच्चा था, मेरी क्लास का सबसे नालायक बच्चा इतने पैसे कमा रहा है. इस दुनिया में समानता की कोई वैल्यू नहीं है. all those things, cursing and cribbing. If somebody of you does not understand, it is just about comparison that I am having a ill-fated thing. That was all an extension of that. The fear of losing the patient all stems from this only, that we have a limited flow. If you have a huge flow for which you have to make an effort, वहां बैठे बैठे नहीं होएगा, या अपने वो जो 3 बड़े वर्ड्स है ना, ईजीओ, उनको ड्रॉप कर दो. मैं डॉक्टर होके लोकल अपने शॉपकीपर को मिलने जाऊं, आई एम सॉरी, मेरा असिस्टेंट जाएगा. इफ यू आर न्यू इनटू प्रैक्टिस, you are settling into practice, why do you have an ego? Why do you have an ego? And if you feel that only the paid marketing is the way to go, I just told you the reason. I'm not going to repeat those. Then pricing with good materials is double usually of colleagues using normal and charging less. Tell me one thing. How many of you actually go into your neighboring colleague's clinic, open up their drawers, look into their materials, look into their menu and price list, and then you compare? Just making assumptions out of nowhere. Don't do that. Maybe your friend might have told you, मैं तो ऐसे करता हूँ, मैं तो ये मंगवाता हूँ मटेरियल, मैं इतने लेता हूँ. So you made all that as a generalized perception that your neighboring dentist might also be doing the same. He might be a fool. He might be using a good material but at a lesser price. He will be having a bigger insecurity than you. You need to understand. He is digging his own grave. बोलते ना कुल्हाड़ी पे पाँव मार लिया, पाँव पे कुल्हाड़ी मार ली. I always use this analogy for dentists. We are fond of doing a bungee jumping on the aches or the kulhada. We are very fond of doing that. वो कम ले रहा, वो 1800 में कर रहा, मैं 1500 में करके दिखाऊंगा. थोड़ा बुद्धि लगा लो. Do you know your costings? Are you aware of all these things? If not, go ahead. Do whatever you want to. Then you say there are more expenses. I have less take-home income. पैसा गया कहाँ? पैसा वहां गया जहां आपने competition try करने की कोशिश की. Then the answer is, but sir, अगर हम नई प्राइस करेंगे तो हमारे पास पेशेंट्स नहीं है, जो हैं वो भी जाएंगे प्राइस हाई के कारण. उसका सोल्यूशन मैं अभी आपको बता चुका हूं in the point number 2 and 3. If you can join these chains together, this will make a lot of sense to you. If all this makes sense to you, type MS in the chat box. Makes sense. If all this makes sense to you, type MS in the chat box. Thank you. Then low standard price with lesser charges of nearby clinics. I already answered that. How do you know they have a low standard of practice? Do you have placed your own security cameras in their clinics? How can you compare? Of course, you may say, you may rely on the patient incidence. वो बाजू वाला इतने में कर रहा है. The patient might be lying also. You are doing in 2500 for a procedure. Just बाजू वाला तो 2000 में कर रहा है. अच्छा, चलो आप 1800 दे दो. This is the way we do. The patient knows how to make a fool out of you. The patient might be a salesman, marketing salesman. You need to understand. You fell a prey to his tactics. Did you have a validation proof? Nobody puts up his price online. So how do you know the exact pricing of his clinic? Very rarely you will have all the information. Maybe an assistant interchange places, or maybe a patient was really genuine enough from your own family who went in there in your absence, you were out of station and the patient told you. But those situations are very, very far and few in between. Then annual raise in treatment charges, how and when? A very interesting scenario colleague put up. I was doing treatment at X rate. You told me, you gave a webinar formula in a webinar in 2020 that charges should be raised like this. So I raised them to Z, from X to Z. Did not work. The X was not working, but your Z also did not work. Then I placed it between my X and between your Z, between the low and the high, midways. And what was the result? It still did not work. What does it tell you? The price is not the factor. There is fault somewhere else. You are turning the wrong screw. You're turning the wrong screw, which is already tightened. Healthcare does not warrant only pricing. You need to understand. So annual treatment charges affect everyone. So if you are not raising even a normal food products पे भी food products पे भी GST है. Of course open पे नहीं है, but packed पे है the normal food products for living. Of course, we look at the enhanced GST collections of July. We forget that in July there were almost 25 to 30% raise of charges as well. So technically speaking, if we look at the June figures, the July figures are less because they are because of inflated prices also. So if you want to keep in sync with your life, life means not only work, it means enjoyment also, recreation also, vacation also. Of course, I'll come to that. So many people have pointed, I've never taken a vacation in years. So if you are not raising your charges, your carry home will keep on decreasing. Your carry home will keep on decreasing. And then you will blame this profession. Change is the most unacceptable thing. We need to accept it. It does pain when bringing about a change. Remember one thing my mentor told me once, if it is hurting, if it is paining, it means it is growing. We have to come out of that comfort zone to make a change. Sorry. So how much money needed for present, for future, and for retirement needs to be invested at proper play according to its need. Now, somebody who puts up this question, I always say, I need to know your standard of living. I need to know how much you spend for your living. How much is the size of your family? What is your liabilities? What are your current assets? What is your current income? What is your age? What is your spouse doing? How old are your kids? Then I can tell you the answers for future and for retirement. A lame question like this does not warrant any answer. There are these all parameters involved. Then balancing of finances. The balancing of finances is the difference or differential between the income and the expense. If you have a certain limit specified for this thing in amount or in percentage, some people have a amount specified. Let's suppose मेरा 3 लाख तो आता ही आता है gross. मेरे को in any case after all expenses 60% घर लेके जाना है. That means 180 I have to take home in any case. Okay. So if I earn 4 lakh, I might take 240. So I have that 60% benchmark. Some have a rupee set benchmark. ये average मेरी income 2 लाख के आसपास होती है gross. मेरे को 1 लाख घर लेके जाना. Next year, next month, I have 2.5 lakh income, but I've invested in a kit or invested in some gadget. Still carry home is 1 lakh. I'm happy. मेरा खर्चा चल जाएगा 1 lakh. So you need to understand what is your quotient, percentage wise or amount wise. Then somebody from tier 1 said, uneducated patients not ready to pay even consultation fee. If the patient is genuinely poor, do a free consultation. I don't mind. But if the patient is worthy enough to pay, prior inform through your staff, through your receptionist, or pasting of a, you can say, a sticker over there. Well, I want to show. Of course, you will have staff. Let them point out towards that. Consultation fee this. They make a decision there and then. But problem वही है, जो अंदर आ गया वो वापस नहीं जाना चाहिए. उससे कुछ ना कुछ तो कमा लो. Because the leads are limited. The flow is limited. Already gave you a solution for that in the previous page. Then patients will say you are costly, but they again come back to us. So my question to that colleague was, is it really a pain point or just an insecurity? That if the patient keep on saying me as costly, he will stop coming to me. This is my insecurity. If I am getting rid of that insecurity, means we need to understand the patient is coming to me that yes, I am going to an expensive dentist as per him. You might be genuinely placed or charges wise. Patient might be thinking you as exorbitant. I am investing in my health with a good person. That tells you you don't have to drop your standards even one bit. You don't have to drop your standards even one bit, because the patient has chosen you for the standards and the good treatment that you are doing. But in case you drop कि अगर इसको ट्रेन रखना है तो थोड़ा सा पैसे इसको कम कर दो. So either you can reduce by reducing from your take home or by lowering your standards using inferior material, inferior service or whatever. If you have to give that, you can say that cushion to the patient, you will do either of the two. So you need to understand which of the two you want to pick. If you want to pick neither of the two, then you keep sticking to your charges, but don't let the guard down. My patients, some of my patients, not all, I'm not very highly priced, I will say that very openly. Some of my patients who are as good as 18 years old, they have grown with me and my practice. They see this thing. We come to you in spite of you being expensive, that you have not dropped one bit of your care factor. This is one thing I get from them. So this is what you should then. Somebody would mention care, somebody would mention standard, somebody would mention it as a way of working, but you need to decide what. Sometimes patient says, 200 fees hai, itna loot lete ho. These things happen when you ask for these things afterwards. पहले बोल दो, this is my consultation fees, 200 रुपए. 200 रुपए लोगे आप? Yes, these are my checkup fees. Don't do that. Let your staff talk. Yes, this is the fees to show to the doctor. This is the fees to talk to the doctor. नहीं, ये तो बहुत ज्यादा है. Understand, he is one of your 28 patients. What is 28? 100 minus 72. I just told you 72 is your ideal rate. Not everybody walking through your door is your patient. So 28 में से है वो जो वहां से ही फिल्टर हो गया, जो फीस नहीं पे कर सकता, वो ट्रीटमेंट क्या पे करेगा? Bye bye, Mr. 28. That should be the way. Then people saying me, I don't like you, not directly, but by saying your charges are too high. Now this is a perception that you have formed. Your charges are too high might warrant again two things. Your standard or your way of working does not warrant that high fee, or I can't afford you because of my own economic condition. We usually think of this factor, economic condition. We don't look at this factor that the patient might be genuinely right. We might be in a smaller setup. Only using better quality materials does not make us a candidate to charge high. There are so many other factors involved. Don't look at I use the best material possible. Whatever has been advised to me by XYZ group where elite dentists are practicing on Facebook. They have advised me these are the best materials. I'm using them. That does not make you a candidate to charge high. You need to understand what is your target audience also first. If your target audience is primarily lower middle class, who can't afford that, you have to bring up their awareness quotient up first before you start investing in a heavy thing. Not always every expensive material and every expensive gadget is good. The simplest answer is a very good Android and an iPhone. iPhone is not the best of the phones. It just has a brand value or maybe a habitual value. People who use iPhone can't use an Android, or they want to use iPhone as a branding symbol or as a symbol of their own stature. That necessarily does not mean iPhone is the best phone. Of course, there will be debates, but I'm not going into that section of the debate. iPhone lovers can never even tolerate from anyone कि नहीं हमारे फोन को बुरा कैसे कहा. मैंने बुरा नहीं कहा. I'm not saying it is not the best. I'm just saying that it is not the best. There are best options or better options in Android also available at a far lesser cost. So again, not going to names and all that, or not going into that comparison, just trying to explain the analogy between these two things. Then the present situation is hand-to-mouth living, and patients, known people, relatives want free checkup treatment. How to handle such mentality? And icing on the cake, they comment doctor is earning too much. The very simple answer is that only people around you know about you. The rest of the world, which is existing around you, does not know that even you exist. You are not visible to people in your area. So build up your digital presence, do your local networking. Even if you are 3 years old in practice, 4 years old in practice, go and explore your area. Having problems in managing expenses. Example, half of the income is going for expenses, rent, staff, payments, consultant fees, material, lab. So that is absolutely normal. An average clinic has a range of 40 to 60. Still better is 45 to 55. The government's presumptive section also accords you 50%. So my dear friend, you are already in the range of that. You don't need to be there or worry about this part. Yes, you may cut down on a few expenses, whichever suitable to you. Inflation is increasing cost of all sectors, but not dentistry. Example, cost of tomatoes is now 80, before it was 40, but RCT treatment is same as before 10 years. It is same as before 10 years because you have not taken care to raise your charges. 10 years back, Dr. Anish Navre was charging 10,000 for a root canal. Now he's charging 25,000 for a root canal. Ask many of the hotshots in your town who are doing that. If you have not raised your charges, it is because of your insecurity. It does not mean that the world around you has not changed. Is there a benchmark that RCT treatment has to be this much only? Even two clinics with the same area, same staff, same number of chairs, even with, you can say, batchmates passing from the same profession, may have a different OPD. Even if they are sitting next door to each other, they may be good friends in college. Ab chahe dushman ban gaye ho, but they may have the same. Their charges might be different. Their way of dealing might be different. Their way of analyzing the situation, diagnosis, treatment planning, and executing that might be different. Very less social status people judge as we are running a pan masala shop. Now, answer to that is your vibe attracts your tribe. Whatever you do will have an effect on your patients. If you bargain a lot in your life, you will have bargaining patients coming to you. If you don't give value to certain higher things in your life, people will consider and equate you to a pan masala shop. If you have not updated your standards, maintain hygiene and cleanliness, you will be equated to a pan masala shop. So you need to attract, you need to know that your wife will attract your tribe. Then dentists have to club together and increase the charges according to inflation. Like many gynecologists have increased consultation fees from 500 to 800. As dentists, we can't ask for consultation. Patient feels it has to be free. Who says that? You feel that. You think that. That is not an acceptable norm. That is not an acceptable norm. So many people do that. Dr. Ajay, keep writing your queries. I'll take all of them in the end. Really? Do you want to compare that? No, I'm sorry. You can't. I'm sorry, you can't. So understand, if you are not able to ask, then the difference lies in your mindset. If you are not able to change your mindset, you will not be able to charge. That is why I call the DMF index of dentistry as the handicaps, the documentation, the management part, and the finances part. The management and the finances are not taught to us. These things should be a part of the curriculum. We cut a sorry figure in the face of the world. Then you need to understand, where does the fault lie? Now the second pain point, or the second, you can say, broad heading, productivity pain points. Lack of patience, less footfall. So I've already discussed that. Relying only on word of mouth is going to be luck by chance. आ गया तो ठीक, नहीं तो किस्मत खराब. So if you have more number of patients, try the organic way, try the networking way. Second, in 3 years of my practice, including the COVID year, it hurts to sit idle for days in clinic. I will ask this dear colleague, do you have a content marketing plan? First of all, do you have a digital presence? Do you have a content marketing plan? नहीं सर, कैमरा के आगे नहीं सर, वीडियो नहीं बना सकते, टेस्टिमोनियल नहीं दे सकते. Whatever you do will come back to you. आप नहीं दे सकते हो किसी को टेस्टिमोनियल, आपको आपका पेशेंट भी बहुत कम देगा, इतना याद रखना. It is karma and it bites you back really bad, whether we realize it or not. What you do in your practice is always going to affect it. So if you are sitting idle for days in your clinic, that means you are not visible. Or if you are visible, you used to have good practice, or maybe if I heard that, read that correctly, so means you have opened up 3 years back. So including COVID year, I must tell you one thing here. You must be surprised to hear that 2020, when COVID initially hit us, yes, most of us were closed. Maybe dealing with precautions or having a limited OPD from March end to, I would say, July mid properly. I also started after July 15, although I had started up in May end when the unlock happened, but properly OPD started flowing from 15 July onwards. And by August, we had reached 70% of our pre-COVID peak in 2020. 2021, we all saw the second wave, which was the deadliest of the 3 waves. We know that what happened in northern part of India, in Delhi, NCR, and even in parts of Maharashtra as well. So we all saw what second wave did. So many families were destroyed. Even we had lockdowns here. Lockdowns, not full ones, but curfews after 12 noon or 1 p.m. in the afternoon. We worked for 3 hours or max 4 hours in the morning for 2 months, April and May. Even starting from March and 2021. Even with these handicaps, trust me, I won't lie, I'm sitting on my clinic chair itself. 2021 was one of the best years of my life in the past 10 years. One of the best years of my life. So if you feel that COVID was the only reason to blame, then you need to ask certain questions to yourself. There are colleagues who have done wonderful work, wonderful in terms of quantity in 2020 itself as well. They rather said COVID was a blessing. We had huge OPDs. Of course, we bought, there were group members who bought PPE kits in bulk. So you need to understand. Then charges according to heavy overheads and increasing inflation on daily basis, especially post-COVID. Of course, if the charges are increasing, you need to understand that we need to raise our charges as well. I gave this formula in June, July 2020, more than 2 years back. How to raise your charges post-COVID, rather during COVID only. COVID was going on at that time. And it does not have to be a raise in all the charges. It has to be a selective raise. In the services that you do, we do the reverse. जो नहीं करते उनमें बढ़ा देते हैं, जो करते हैं, so that we don't lose the patients, we raise the charges in there. Then practicing in rural areas, managing OPD too hectic. Rural areas have a, you can say, a setup which are the two terms which are used primarily in dentistry: mass practice and class practice. So the kind of terminologies, again, our own man-made terminologies only. The footfall is too much. What does that mean? Even if your OPD is hectic, you need to build a system into your practice. People always argue, rural area में नहीं होता है sir, लोग पढ़े लिखे नहीं हैं. I give only one example. That is good enough. My good friend Dr. Ashish Karve from Neral. It is a small village. He does an appointment practice. He has a more than decent good practice, and he charges more than decently than most of the tier 1 people as well, sitting in a tier 4. If he can do that, why can't you do that? Stop giving excuses to yourself. There are always 1,000 reasons to say a no to a task, but there is only one reason to say a yes. Try to find out the optimistic way rather than the pessimistic way. नहीं ये तो होगा ही नहीं, ये तो हो ही नहीं सकता. That elephant theory comes into being. Just because you failed at it once, you are even afraid to try it twice. Get rid of your shackles and the elephant theory in your mind. What is that elephant theory? Some of you might be aware of that. When an elephant is a kid, young kid elephant, he's tied to a small tree with the help of a small rope. So being a kid elephant, he can't break free. Kids are naughty. So even that elephant tries to break free. He fails. So this phenomenon gets embedded in his mind that I am tied to a tree, so I cannot get rid of that. Even that when the elephant grows big, it becomes one of the giant creatures of this earth. It is still tied with the same rope. उसके लिए तो ऐसे सिंगल एक फिंगर का काम है, ऐसे करेगा तो रस्सी का शैकल सब टूट जाएंगे. But वो elephant theory, that is why it is the name. He can't break away from that tree because it is in their mind. Because I failed at it in my childhood, so this is not going to succeed now also. So get rid of elephant theory from your mind. Lack of work-life balance. Now, this primarily stems from a few things. Number one, you're charging low. Number one, you're doing everything by yourself. Number two, you're not delegating what is required. You want to please every patient. What else? All these factors. What are you doing? One of the colleagues has a query also. Every patient wants to come at 6 to 9. What should I do? सुबह मैं free बैठता हूँ, शाम को करता हूँ. Because you don't have a system set in your practice. I started in the evening OPD. For the first 3.5 years, I practiced in evening OPD only. From 1st Jan 2000 to 10th June 2003. Almost 3.5 years, I worked only in evening OPD. When I shifted to morning OPD, I started transferring my patients from evening to morning. One reason or the other reason. Extraction है, सुबह करवाओ, आपको फायदा है, कोई प्रॉब्लम आएगी तो get it, you will have whole of day to check it out. Of course, I'm not believing you're doing every kind of restorative dentistry only from 6 to 9. You might be using surgical things also. You might be using that. Try shifting the surgical part first in the morning, and slowly the chain develops. And slowly the chain develops. So when you devote time to your work, that is your ethics, work ethics. But when you devote over work or overtime to your work, that is lack of balance. You need to remember one final thing in this. Work is a part of your life. Work is not your life. If this thing makes sense, right? Type MS in the chat box. Work is just a part of your life. Work is not your complete life. So you need to devote time to everything. Thank you. Lack of time management. So lack of time management is simply stems from the same phenomenon that you don't have separate heads. As in operations, sales, marketing, HR, management, all these are separate sections in any organization. We don't have that. inculcate a hobby, inculcate a game. इतना sedentary lifestyle है हमारा सबका, सारा दिन एक ही जगह. You need to understand. We need to give ourselves a breather. Our body is yearning for that. Inculcate a game or a outdoor sport in your schedule. Can be cricket, badminton, football, TT, anything, running, anything. At least 3 days a week. At least 3 days a week. Stop this habit of sleeping late. Stop fooling yourself that I am a night bird. My maximum productivity comes in the night from 12 to 2, 12 to 3. Stop fooling yourself. There are people in this world who have written books over it and are highly successful authors. The 5 a.m. Club by Robin Sharma. I am a member of 4 a.m., 5 a.m. Club. Rarely I get up late. I can tell you. Because again, वो elephant theory है. Because you have not given the morning productivity a chance. You are living in that false sense of belief that night productivity is the best. So unless you give your morning productivity a chance, try breathing in fresh air in the morning. Go for running, go for jogging, go for sport, go for game. I am 45, will be turning 46 next month. I'm still having a game in my schedule 2 or sometimes even 3 days a week. And I don't try to miss it at any cost. Yes, I do my clinic for 8 to 9 hours max, rarely 9, otherwise 8 only. I recently changed my clinic timings. Increase 1 hour in the afternoon, cut down 1 hour in the evening. Now I shut off my clinic at 7. There are patients who said, डॉक्टर साहब 7 बजे बंद कर दोगे, हम तो आते ही 7:30 हैं. Change your time, no problem. I'm going to shut off the clinic at 7. I close down my clinic now at 7 instead of 8. For 22 and a half years, I shut down my clinic at 8 o'clock. After 22 and a half years, I'm shutting it down at 7. If after 22 plus years, I can't choose my work hours, then लानत है ऐसी practice पे. If I can't choose my own life's comfort, then to hell with such a practice, frankly. If I can't do that, my patients don't run me. I run my patients. My patients don't run my clinic. I run my clinic. They are not the boss of my clinic. I am. When I shifted to my own morning OPD, they adjusted. वैसे भी when the coming festival season, the festival season starts from August with the advent of, you can say, Raksha Bandhan or usually the Tej festival. The festival season starts. In the festival season and in the winters, usually we get free at anywhere there at 7:15 or so. Rarely, of course, there are days when we get an extension. Not productive some ways. So I managed to change that into productive time in the evening. Now I have 7 to 9 free time with me. Of course, I'm not working at that time. What I'm doing is something else. So you need to decide your prioritization in life. Then guessing the patient expectations. This is a very, you can say, a very difficult question for me to answer. We are not Jyotishis or astrologers. If you want to guess your patient's expectation, better enroll for Mr. Bijan Daruwala's workshop. So the best option is that we can't guess patient's expectations. If the word was gauging the patient expectations, we can still gauge that based upon the patients we talk to. But the problem is that we rarely talk to the patient. We do only one-way communication. We convey, and convey. Then knowledge about materials. There is n number of literature available online. There are so many Facebook groups which discuss genuinely good dentistry. They do update everyone about materials. If somebody complains, "Nahi, I am not a social media fan," then it is your fault. using technology as a boon is your biggest asset in today's time. But then it comes with its shares of bane as well. We tend to overspend our time. We tend to misuse that time. We tend to do mindless surfing and all that. So again, morning hours, very less number of patients, half of the month's time, morning sessions goes unproductive. How do your patients know that you exist in the morning as well? Only your existing running patients. So if those patients you are not asking for feedback as well, no testimonials as well, how do they have a validation that you are working good? If you are working good and you are working well and they give you feedback, they are bound to send you referrals at that point of time. But where is your effort other than word of mouth? If you are not putting any effort, then you have no one to blame. When you don't have enough leads, enough footfall, enough walk-ins, you need to understand. See, when we talk about investment in technology, investment in learning new skills, investment in buying new materials, new gadgets, people say, first I will earn, then I will invest. Friends, by saying so, we are going against the very law of nature. Nature's law says, first you sow, then you reap. And you are saying, first I reap, then I will sow. If it is a bulb on movement, type BO in the chat box, bulb on. First you sow, then you reap. So don't try to go against the nature. We live in that false sense of belief and insecurity कि नहीं ऐसे तो पैसा आ नहीं रहा, पैसा लगाने से क्या आएगा. Have an abundance mindset. We then अगर ऐसा कुछ होता है मुझे ये नहीं आता है तो इसमें मेरी क्या गलती है, मेरे कॉलेज ने मुझे कुछ नहीं सिखाया, DCI की गलती है, करिकुलम चेंज नहीं करता. Do you actually believe that you were purely serious in your college time? You properly paid attention to everything in your college time? You were a very, very genuinely good student? You extracted everything possible from your teacher? Then who is to be blamed? So high value cases become rare these days post COVID. I just told you 2021 was one of the best years of my life. Even it was the 22nd year of my life, it was one of the best years. Although I've cut down a lot on my practice, I've filtered out a lot of OPD. I don't do as many, even in spite of working 8 hours, I don't do the bulk of OPDs. I don't pride myself in doing 20-25 patients a day. I'm happy with 8 to 10 patients a day. That is even more than enough for me. So if I had one of the best years, the high value cases would have had a strong contribution in that. So don't blame COVID for everything. Ambani and Adani became millionaires and billionaires in COVID only. So don't give the reason of COVID. The GST collections became one of the highest in COVID only at that time also. Don't blame COVID. People did not lose their purchase power except for a very small period of time. People did not lose their purchase power. Yes, exceptions there, but don't generalize this thing for everyone. We're just trying to fool ourselves if we say so. Then 30% fall in overall revenue of clinic, but 50% increase in salaries, rents. I'm not ready to believe what you said, my dear colleague. If your revenue fell and you still raise your charges, I'm not ready to believe it. Because colleagues have done the reverse. Even if the fall in revenue was 10%, they have cut down the salaries by 30%. So I'm not ready to believe it. But if that is the case, then it tells you to evolve yourself. That word of mouth is no longer the only word or only, you can say, the advertisement or the marketing campaign. You need to have a digital presence also. When I don't have patients, what do I do? productive in that time. Not always can I do upgradation of skills in exactly same time frame. I would want to do something that utilizes all my potentials other than dentistry. Do a SWOT analysis first. What are your strengths, weaknesses, opportunities, and threats? The strengths and weaknesses will tell you what things are you good at and what things you may change or may like to change in that. So we need to understand that we need to have a focus in the clinic time. You may do a SWOT analysis. You may come across as a hobby. For example, knitting comes out to be your hobby. Does not mean that you do knitting in the clinic in your free time. That is not the best utilization of your potential. In management, we always say your focus is your most valuable asset. In finance, we say the time is your most valuable asset, but in management, focus is your most valuable asset. If you don't focus in your clinic times on your clinic work, then you need to know that you are faltering somewhere. If you are free, try to build up a system in your practice for everything. I'm not sure whether you have every system set up in your practice, because even after 22 plus years, I can't say the same for my clinic. In spite of the fact that I am teaching so many things, I can't say 100% full system in my set. There is always a scope for improvement in one thing or the other. So things evolve, things keep on changing, things are dynamic, and we need to put in sustained efforts to turn the loosened screws of our practice. So if we are not tightening our screws good enough, long enough, then slowly and slowly they will come off. And ultimately the whole thing will derail. So my advice, whatever you find after SWOT analysis as your hobby, don't use that in your clinic. Utilize the clinic time for your building up the systems or upgradation of knowledge. If you still find time after that नहीं मेरा काम फिर भी इतना ही है क्योंकि मेरे को सिलेक्टिव काम करना है. This query was from a female, I guess. So if you still have, cut down on your clinic hours. From 8 hours, now I will work for 6 hours. In my clinic, 2 hours I'll go home and devote to my hobby. The 2 hours जो मैंने अपने profession से चुराए हैं, fair enough. Who says you to work 8 hours? Cut it down. Health is the most neglected in dental practice, especially evening practice. Almost all the patients need appointment between 6 to 9. It's really difficult to fix hours of practice because you don't have a system of your practice set up. You're not communicating enough, long enough to the patients. As I said in the previous query, similar query also, you may not be doing only restorative work in the evening. You may be doing surgical work also. Start shifting that first in the morning. As a surgeon, I would not, even surgery is my favorite field. As a surgeon, I would never want to lose my precious sleep. Anyways, I get up early in the morning. If somebody wakes me up at 1 or 2 in the night, my whole sleep goes for a toss. Of course, attending to patient is again my moral responsibility. But why do I take myself into that situation where I have to sacrifice my sleep? So shift that patient to the morning. Have a full day of follow-up if needed till the end of the day and cut it down. And I find it very strange that people work till 9. In certain areas like Kalyan, people are working till even 11 or 12 in the night. They say our predominant target group is the salaried people who come from office at 6 or 5:30. So we work till 11 or 12 in the night. I went to Jammu for a lecture about 4-5 years back to meet my old friend after the lecture. The clinic was open. I went in. The assistant said, "Doctor Sahab abhi aa rahe hain." He had residence at his first floor in the same premises. The Doctor Sahab abhi aa rahe hain. Abhi dinner karne gaye hain. Okay, fine. And I could find huge rush of patients sitting in his waiting. So आज rush ज़्यादा है क्या? नहीं, आज तो कम है बल्कि. So why? So what time do you work? We work till 3 or 4 in the morning. What? We start at 6 or 7 in the evening and we work till 3 or 4 in the morning. What is this system of working? This is the way we are working since many years now. Great. Welcome to the new world of dentistry. You're doing this. Again, the personal choice. So with this, we have completed the financial pain points and the productivity pain points. So we'll be starting with the process pain points in the afternoon session at 2 o'clock from here. So before I wind up, let me just, of course, there are a few things. So thank you so much. And most of you are part of this, but some of you might not be part of the finance community. I have a finance community as well. If you want to be added in there, you already know the rules. There's no outsider is there. I hope so that the link is only shared between the members. So this is my YouTube channel. Most of these answers are already on the YouTube channel, which I'm giving you today. Of course, adding a few new things, but these things are already existing on the channel. So there are a lot of videos already. Search it and get answers to all your problems there. So we are launching this also officially to plug the loopholes and the handicaps of dentistry in the form of that. Of course, as WhatsApp, I have separate communities for practice management, documentation, and finance. But on Facebook, I'll be having one joint community for both of these. Of course, this will be a dentist-only community. The lay persons won't be allowed in this. They are allowed in only the finance group, but in a dentistry group, no one other than dentists will be allowed. So this is a joint venture of my two companies, which I am launching today as well, Bhavsagar Ventures and Bhavsagar Academy. So the work will be there, only the segregation has been done by me. So the part 2 is at 2 p.m. We'll start sharp on time like this. Before that, I'll be taking up the queries which have been posted, or you get a chance also to ask live from me now. So part 2 will be there. If at all some things are left, maybe I'll think of another option, another part maybe next week if I am not able to cover a few things, because I won't be rushing up the things. I'm trying to answer a few things whichever to the best of ability that I can. So this will be webinar again in the night at 8 p.m. on finance, lessons from the recent IT filing, and of course how to correct those mistakes. So my social media presence by Dr. Bhavdeep, and of course the PhD walls will also be in the same digital footprint in the name of Dr. Bhavdeep. So do send me your feedback in the WhatsApp group wherever you have it, so that it sends a message to the remaining 1400 plus who were also a part of the pain points cell and they didn't bother to attend. So Bouquets and Big Bats both will be welcome in equal measure. Thank you, and I stop my share for questions from all of you. Firstly, I'll be taking up the questions from the chat, and then from you live, and then we will wind it up. Okay. Still not unmuted any one of you. I'm just going through the queries first, and then I'll unmute all of you. Okay. So Dr. Raghunandan asked how much time, he's already left, I guess. So how much time should be spent on digital marketing like LinkedIn or Instagram? See, again, digital marketing is a full-fledged effort. If you can do it yourself, most welcome, but you need to understand the basics or the algorithm of the same before you dive into that. But anyways, before that, if you're not comfortable, you can hire the services of a digital marketing agency. As an entrepreneur, you don't need to do everything yourself. That is the beauty of this task. You may need to know everything, but you don't need to do everything yourself. There is a difference between the two things. You need to know, because then only you can pinpoint. For example, if there is a system set in your practice, you know what is the protocol going to be. Then only you can guide your staff. But if the staff comes to you and asks you, sir, ये हो गया, अब आगे क्या करूं? ये तुम देखो, मैं क्या जानूं? Like that approach, that should not be there. So I had some issue when neighboring dentist says I do X amount of implants and charge more. This is very bad to take at face value. Drop this point of ego. One of my batchmates, a famous, notorious backbencher batchmate of my class, who never even passed in the first attempt, used to proudly say in the second or third year of practice, we started clinic almost together, I feel very confident. I have 100 units of crowns in my practice. metal and PFM included. Of course, metal free was not there. I'm talking of year 2001 and 2. So he started about 6 months late from me. Said, I am very happy. I have 100 units of practice. It is a personal thing. Later on, I came to know he was charging half the price as what I was charging at that point of time. And I was not charging over. He was undercharging. So my 50 were equal to his 100. Fair enough. He was bending his back. He was hurting his neck and back more than me. He was jeopardizing his health more. I don't have to lose. So drop this word of something having. There will always be people who will be doing better than you, worse than you. If you want to look at that, look at the positive side. Don't look at the negative side. How much is the success rate? How much is the patient compliance? How much is the repeat value? Do you know about those factors? Who's doing X number of implants? No. So don't just blindly look at the number, look at the return part. Okay, makes sense, makes sense. Dr. Ajay says, how can we say I charge 30,000 for metal braces? It's always 30 onwards depending upon the case complexity. You can always put it up that the bare minimum basic charges for orthodontic braces are this. The rest depends upon the case complexity. For that, you need to be very well in sync with your talent of diagnosing and treatment planning, and of course, communicating the same to the patient. Sometimes in a zeal to do that the case is complex, you don't do that. I just give you a very you can say recent example happening these days itself. One of my old patients whose whole family used to come to me, his sister and sister's family as well. In fact, the sister only referred her sister and their family, and the second family's son came to me in the month of November or December. He had a bridge to be done. I offered him an implant. He said, no, I'm leaving for Canada in about 2 weeks time, so I can't get in an implant done. Anyways, it is beyond my affordability range. So after explaining everything and the consent part, verbally, I told about the costing part. So that is where he said, okay, I'll go back and ask my dad and come back. He called me up next day. He said, I'm sorry, your charges are high, so I won't be coming. Fair enough, no problem. So I was surprised that the family has been my old patient. The patient went away. The patient never came back. Cut to August 2022. 8 months later, the patient comes to me. I see that the bridge is already in place. I open up my old x-rays. I took an x-ray. I see leaky margins. I took up an x-ray. Shocked to find that 5 and 7 had been RC treated. I asked him, why did you get them RC treated? I said, I don't know. He said, I don't know. The dentist himself did it. I said, there is no decay. When you came to me, I had taken the pre-op x-rays. Then he said, तुमने बाहर जाना ना, तुम्हें problem आ जाएगी. So below the bridge, he had done already intentional root canals in 4, 5 and 4, 7 to give a bridge on 4, 5, 4, 6, 4, 7. And a 21-year-old in a 21-year-old. Anyways, what brought him to my clinic was the margins were leaky. He was having sensitivity. He was having, we can say, swollen gum margins. You can say the fluids were going through and through the bridges. He requested me for a bridge change as he had come just for 15 days. He was going back in the end of, before the end of August only, back to Canada for his studies. Then I took up the topic of what happened 8 months back. Said, why you did not come? And how much did you pay? Said, doc, you told me for all the work, the estimate was close to 35,000. That doc did it in 29 to 30,000. So now, what are you going to do? Just for the bridge only, you're going to spend 15 to 17,000 rupees. Plus the restorations, because of the leaky margins, one of the tooth had further decayed. Now you saved 5 or 6, got your 2 teeth intentionally root canaled, and now you are getting the same done from me. Calculate, did it come out to be expensive or cheap? You will be spending close to 48,000 in this exercise. Old dentist plus mine combined. And what you had to spend at that point of time was 35,000. It could have been worse also if you were not able to come back. So he said, "Nahi, I made a mistake. I realize it now. Now they are paying what I demand." Of course, I raised my charges again in January. So they are already paying me more than what I was charging before. So it is all about diagnosing, treatment planning, and conveying and communicating to the patient. So, of course, the better you can communicate, the better you can command a price. Makes sense. Okay, Dr. Raghunandan, no problem. Bulb on, bang on. Thank you, Dr. Ajay. Dr. Deep says, local network kaise karne ka? Dr. Deep, I told you have to go to your surrounding shopkeepers, surrounding area. Every area has at least shopkeepers of every kind. Every kind. No area you can say will be bereft out. Start with that. Start with that. There may be offices, there may be companies. You can network with a lot of people. You can network with a lot of people. This is the first way to do it. It is not that this is the end of the road. The digital footprints are one thing. The local physical humane touch or human touch is one thing. So try building on that. Of course, I'll give you a chance to ask once I take up all the questions. Thank you, Dr. Deshpande, sir. Okay, thank you, Dr. Raghu. Thank you, Dr. Salima. Thank you, Dr. Ajay. Dr. Sabyasachi, thank you, Dr. Mustafa, thank you, Dr. Mahesh, thank you, Dr. Prayan, thank you, Dr. Bhavna, thank you, Dr. Bindu, thank you, Dr. Manali, thank you, Dr. Parul, Dr. Ravi, thank you, Dr. Namrata, thank you, Kaizen, thank you, Dr. Satish, thank you, Dr. Mohak. Dr. Amolik Jakhar says, how can we build systems in clinic for management? See, we all need to have a clarity in our mind first. Then we need to have a competency for that. Then we need to have the courage to implement those things. Systems are not a ready-made manual. They are the standard operating procedures which work as per individual clinic. What works in my clinic may not work in your clinic. For example, for documentation, if we talk the registration form, the feedback form, the medical history form, the consent forms, these things are the SOPs. 90% plus of the patients have to fill it. Those who are getting the treatment done. We don't get it done. My way of working is we don't get it done from all patients who walk in. Those who become my patients, they fill in the details. People have this notion or their, you can say culture, I wouldn't say habit, I will say a culture is patient aaye pehle form bharwane ka. I believe in that Munna Bhai philosophy. वो patient मर रहा है तो उससे form भरवाना जरूरी है क्या? No, it's not. So anybody who walks in, basic triage, oral history, name and everything, or whatever we have, or any past records, and we proceed with the checkup part. Once we have a communication setup done, then only we proceed on to the, you say yes, then we need the patient's everything. The KYC, the history form, the consent form, and everything will be done. But for the patient who is just come in for a second opinion, how do I know that? So only when I talk to the patient. जो ओपिनियन लेने आया उसको कोई इंटरेस्ट नहीं होगा आपको अपना फोन नंबर, अपना ईमेल, अपना बायोडाटा देने का. Why do we insist on that? Again, personal choice. This is the way I work, so I follow that work way which has given me success. You are free to follow what you are doing. You are free to adopt whatever I'm. So when you have such kind of SOPs for each thing in your practice, for maintenance, for record keeping, for consents, for way of working, for appointment procedures, that becomes your SOP and that becomes your system of practice. So you need to have that set protocol in a written format for every system. Okay. So thank you, Dr. Amit. Dr. Ravi says, I've upgraded to my new clinic with larger setup, but at my old place, other dentists came there and now patients are confused. Dr. Ravi, the transition has to be sudden, has to be gradual and not sudden. Whenever you have to plan such a thing, You have to gradually make patients aware of this thing a few months before. Of course, you can't go that to whatever you have done in the past, but always make a gradual transition. If you do a change overnight, nobody will accept that. But if you have been gradually preparing your patients, and again, communicating with the local shopkeepers around that, chemists around that your area, that yes, we are shifting to new premises, that would really help. But if not in that case, now again, if the patients are confused, the patients might be having your KYC, or you might be having patients KYC, their phone numbers. You can send messages to the patient, emails to the patient, reminder card that we are relocating to a new place, or we have relocated now to a new place, and this is our new address. And the phone numbers are the same. You can get in touch with us for those who are not able to inform. Just I'll give you an example of our WhatsApp groups only. When we were condensing these groups from 6 to 3 groups, I told you all on 10th of June to take a backup. I gave you all 1 month time that we will be transitioning in the first week. By 10th of July, transition would be complete. I kept on reminding every week. I kept for the backup part, and slowly and gradually, I shifted from 456 to 123 first, without eliminating from 456. After 6 or 7 days of transition, I eliminated one by one from group 123 from group 456 in the morning. Then similarly, after break of 10 days, did the same exercise for finance group as well. So this is a gradual transition phase. If I would have done overnight, what happens? Panic and chaos. Because change is the most uninviting feeling in the world. Nobody wants to change. Nobody wants to go out of their comfort zone. Just a simple analogy. Don't take it realistically, but just to give you an example in that part. So if your patients are confused, send them reminder messages. I hope you have phone number for all your recently treated patients in the past, before shifting, whatever you had in the past 6 to 12 months, whatever you have, send them messages. You have relocated to a new place, and these are the new premises, and these are new contact numbers, and these are new timings if you have changed the timings as well. Okay. So prioritizing is the biggest challenge from me. Difficult things mind does not accept and do easily. Going for easy and comfortable things. How to balance that? Dr. Raghu, the simple way is eat the frog first. Do the difficult thing in the morning. Always have a difficult thing in your schedule. Otherwise, what will happen is Parkinson's law will act. Parkinson's law means एक चीज को अगर आपने सोचा ना, आज मैंने मान लीजिए अपना फोन का व्हाट्सएप का फोल्डर खाली करना है, आप वैसे ही जंक नहीं रखते हैं, आपके पास एक 1.5 GB का जंक होगा शायद, उसको खाली करना है, which is hardly a 30-minute job. So by chance it is raining, you have all your appointments cancelled, so you have 3 to 4 hours at your disposal. तो आप पुरानी पोस्ट देखते देखते you will start going through that. Oh, this was a post I shared there. That half an hour job will become 3 to 4 hour job. This is Parkinson's law at place. The time allocated actually becomes a job for that. There is a very interesting story behind the Parkinson law. It became that one of the lady had a task to post a postcard daily. To find a postcard, write it and post it, which was technically, and the post box was just outside her house. It was technically a 3-minute job. Find the postcard, write it and post it. Less than 3-minute job. And she used to spend the whole day. Firstly, half an hour looking for the postcard, then half an hour looking for her glasses, then thinking about it, then liking, then तैयार होके जाना पड़ेगा, कैसे करें and all that stuff. Then whole of day should used to pass in that. So from that postcard theory, 3-minute job, that law became Parkinson's law. You can read more about that in the September issue of IDA Times. So I've already explained that multiple times in the group as well. But this is the way, eat the frog, and of course, plan for the things, plan for the difficult things first. We tend to over-assume, expect from ourselves that we can do this task in this much amount of time. Unfortunately, we can't. Unfortunately, we can't. And that is where we need to know. That means your assessment of yourself or your SWOT analysis about yourself is not correct. This is the way. I hope you get a idea of that. And Dr. Gurpreet says, thank you, sir. I agree. My practice is not visible in my locality, but I'm trying to establish my visibility this year onwards. Can you please advise me some idea to increase my visibility? I already did, Dr. Gurpreet, in detail. So also I did try online branding for a while, but reach was not that much as an analytics. So what and all I do for offline marketing. I hope my practice is in rural area. I covered all these 3 points probably, and I covered them at least twice. I think you joined in late. So I'll get back to this query later on. I've already done that. So my query was for consulting clinics, as rarely anyone sends records before my scheduled visit, though I have narrowed down my consulting from 70 to 20 now. So consulting clinic, rarely anyone sends record before my scheduled visit. So again, you have to set a protocol for that you need records for that. So if you have cut down on your consulting, even 20 is way too much, I would say. So the best work is being an entrepreneur yourself. Nothing beats your own clinic. Nothing, you can say, gives you freedom like your own clinic. I can see many becoming a slave of their clinic as well, as from the queries we saw it. But nothing can beat being an entrepreneur. Being an entrepreneur is a blessing. Being an entrepreneur is a blessing. It is a slave to be in a job. Nothing, please don't mind my words, but being in a job is like being a slave. You get a fixed income, you get a fixed work, and you get trapped in that mindset also. And once you work for 10 plus years, however you try, very rarely you will switch to full-time practice. And you will keep switching back to that mindset. नहीं वो job ही अच्छी थी, कम से कम इतने पैसे तो आ जाते थे. This happens. This happens to most of the people. I see that in my family also, people close to me also, who worked for so many years in job, they can't become an entrepreneur. It requires a lot of hard mindset to do that. So cut down on your work. It will surely help you a lot. Thank you, Dr. Dhagash. Thank you, Dr. Manish. Vivo V2141. Please put in your name, yaar. I don't feel like Hello Dentist Vivo V2141. So hello, sir. If we are not getting form filled before OPD, where should we explain the charges and treatment plan? Consent form. I'll share that in the afternoon. Don't worry. I'll share your demo. We do everything in the consent form. The treatment planning part details, the PCIs, and of course the money part also in the consent form. And who says everything has to be done in first sitting? Who told you to start in the first sitting? That is for you to understand. So Dr. Maulik says, thank you for wonderful session as usual, very calm and planned manner. You are truly guide. Thank you. Dr. Vinesh, thank you very much for elaborating on points. Wonderful session. Thank you so much, Dr. Purva. We need someone to teach us the sales language. Don't worry. Don't worry. I teach sales and marketing as well. Thank you, Dr. Raghu. Okay, Dr. Vivo V21 is Dr. Nikhil Ranjan. Okay, never mind. So Dr. Ajay says, thank you for the enriching session. Looking forward for the rest of the day. Thank you so much. So I'm unmuting. You can unmute yourself and ask your queries one by one. Those of you who are remaining out of 69, 70, we have 50 still there. So Dr. Ajay, yes, you had your hand raised since long. Go on. Unmute yourself if your query has not been answered as yet in what you put up. Unmute and ask.
Hello. Good morning, sir.
Yes, good. Switch on your camera. Yes. Go on, go on.
Sir, the query which I had was, actually I'm a consultant orthodontist, so I used to visit many clinics. So the charging thing, many times, like it's the prerequisite, everyone asks ki, how much do you charge for so and so cases? So when I go and suppose they say if we want to do a metal braces for this case, I always tell sir this case needs some additional inventory like TADs or something else. And then accordingly, and moreover, the case is a complex one, it may take at least more than 2 years to finish. So accordingly, we need to quote the charges. Then many a times from Array, we have already quoted and told the patient ki this much will be the charges. And mostly this is done by the senior ones, like trying to explain the new clinicians who have recently opened their practice. They usually do get along, then they have their own set of problems ki doctor साहब बड़ी मुश्किल से आया, start कर दीजिए, कहीं ऐसा ना हो ये भी निकल जाए, ये नया केस बड़ी मुश्किल से आया.
Again, those insecurities. Na? So the senior pros, again, two issues. Number one, you can't talk it out to them openly, and they can't say, now we have committed, and why should we change? The old patients know us that we do in this price only. So tell them very politely, okay, sir, I'm doing this case. What you have committed, I honor your word, but in future, please do not quote money without me having a look at the case. I will tell you what extra is needed. Please don't. Say it politely, say in a way that they don't hurt. Or if we say, sir, please, I am the orthodontist, let me decide what are the charges or what will be the things involved in that. Please don't commit it in future onwards. This is the wrong way to say that. The right way to say that is, sir, I honor your word this time, what you have committed, even though it comes out to be expensive, but I don't want to, you can say, I don't want to spoil relationships. I want to build on the relationship that we have. But in future, please let me have a look at the case before you commit any charges. If it is a simple normal case, we'll proceed with whatever you have been charging. But if it is a little complex, I hope you understand that inflation is rising and I need to do that. There are only two things that will happen. The senior pro might say, no, you can't charge high. If you charge high, I will change the orthodontist. Thank you.
I'm
Thank
more
you.
than happy with that, sir.
Thank you.
That's
Say
how
that.
I've
Thank you,
managed
sir.
this. Yeah.
Thank you, sir. Say thank you, sir. And that is the best way to have an exit route. Now, if that guy knows your talent and caliber, that you are a good orthodontist, and losing you will make a dent into his orthodontic practice, since consultants for ortho are rare to find, maybe for him or around his area, then he will not let you go and he will sign to your told norms and things. But if at all he has options, then he'll be rude to you and say, and then tell it that, yes, sir, I will complete the cases that I have, but after that, let's cut it short. Let's don't leave the cases in between what you have started. Even if you are paid or not paid, that is a secondary thing. That is your moral duty to finish it, and his moral duty to pay you for the cases you are doing, because you also charge maybe installment wise. They also might be charging installment wise. So if they are not charging once or twice, they have not paid you. Tell them that, sir, it's been 2 visits, you have not paid me, I'm fulfilling my moral obligation. Yes, we have cut short our relationship, but I'm fulfilling my commitment. So please don't go back on your commitment of paying me on every installment. That is the way. You don't always need to fight, you don't always need to be rude to break up the relationship. That's it. Okay, so but think of your own practice. That is the best way.
So that is what my main focus is on.
Great. Yes, Dr. Deep.
A very good morning, sir.
Good morning, Deep.
सर आसपास जब लोगों को सर नेटवर्किंग करने से आई हैव ऑलरेडी ट्राइड, पर लोगों का मतलब एकदम से मुझसे बात करने क्यों आ रहा है, तो मतलब आई डोंट फाइंड कि क्या कॉन्टेक्स्ट में उनसे बात करने की, मतलब उन लोग का रिएक्शन होता है क्यों भाई क्यों आ रहा है तू.
It's very simple. When you go without reason, everybody will say. You go once, they will have an awkward reaction. Hi, how come again? You were never there before for the whole period of time, 2 years, 3 years, whatever you have opened your clinic. You were not there. Go once, have faced that awkward reaction, still be polite. Diwali is coming up, festival season is coming up. Go to those people again after a gap of 1 month with a small gift in your hand. 100, 150, 200, whatever amount you can afford, whatever budget you have allocated for this thing, take that gift along with. I came to you. This is my happy Diwali, and please do take care. Keep us in mind when referring patients. This is one of the ways to again. If he doesn't send any patient to you, understand festival season में वैसे भी OPDs कम हो जाती हैं. Give a reminder after 1.5 months again. But again, don't be pushy. 1.5 months के बाद New Year आ जाएगा. Again, take a gift along with. So people value those things. सिर्फ जाके अपना कार्ड पकड़ाओगे ना, वो भी फेंक देगा डस्टबिन में उसी वक्त. First time there will be an awkward reaction. Again, that is a change. Acceptance to change is difficult. पहले गायब था, इतनी देर से था, पहले तो आया नहीं कभी, ये इनॉग्रेशन पे तो इसने हमें बुलाया नहीं, अभी आ गया. So the way you talk, the way you convey, once will be awkward, once will be difficult. After that, it becomes, you can say, used to that. Especially when you go with a gift in your hand. So you're lucky that this thing is happening just before the festival season, and you have all the time to plan for your budget, plan for your visit along with that. and of course have a follow-up also after 1.5 months or so. Diwali is at a very opportune time of, I think, in the 25th or 26th of August or October, sorry. So after 1.5 months or 2 months, New Year is there or Christmas is there, you can have a repeat visit then also. If you, even if you find traction or don't find traction in both the cases. Okay.
So, sir, all type of this shops has to be visited only, or medical shop or something of that sort?
I think all the shops which are running well in your area, it can be a Kirana shop, it can be a clothes shop, it can be a utensil shop. Always try to go there. Go there when you find them not too much busy.
Yes.
Okay? Try to do that. If you find someone busy, skip that. Make it a point. You will not be covering everything in one day. You'll need about 6-7 days to cover all the shopkeepers around you first. So it's not only the medical ones, go to all the non-medical ones also. You will be surprised to find non-medical people will send you better reference. It is nothing about referrals or not, it is about your visibility part. Somebody goes to a kirana shop, chocolate लेने लगता नहीं यार रहने दो मेरे दांत में दर्द है. दांत में दर्द है तो वो है ना, डॉक्टर्स को दिखाओ ना. This is like a cold referral. नहीं अच्छा है, हाँ मेरे पास आया था, बात तो अच्छी करता था, might be good also. That is a halo effect. You talk nicely to that patient, your one aspect of your life, the communication that you did will create a halo around you. वो बात अच्छा करता था तो काम भी अच्छा करता होगा. That is a perception. We live in a world of perceptions. So that is a halo effect, which is a universally accepted phenomenon. So have that halo effect around you. This is the way you can do that.
Thank you so much. Thank you.
So any more queries? Okay. Okay then, guys, it's almost 8:40, and I see you again at 2 p.m. sharp with the similar session. You might be seeing it is being streamed, you might be seeing it is being recorded, but that is for my own purpose. It is not being streamed on my page. It is not being streamed on my YouTube channel. It won't be there because there are sometimes certain reasons there's certain content which I don't share anywhere. The YouTube already has enormous amount of content, so doesn't need a specific content in that. So bye-bye, take care, and I see you in the afternoon session at 2 p.m.